Hi everyone, welcome to session 10. We'll be focusing on mindfulness. This is part 1. Please don't forget to press like and subscribe. Welcome back everyone. As I said, we're going to be focusing on mindfulness in this segment, a general explanation of what mindfulness is and the basic premises of mindfulness. There's no doubt that we all live very, very difficult lives. The level of difficulty and the accompanying challenges that we encounter are indisputably different, and they vary according to what our level of coping actually is. The challenges that we face and how we deal with them are contingent upon our personalities. Some people are naturally better able to cope with life situations. They're more tolerant, they're more patient, they're more easygoing, they're more flexible, whatever it may be. So our personalities in of themselves have a lot to do with how we handle stress, anxiety, depression, and of course, pain. Secondly, our access to resources, whether it's access to counseling, whether it's access or financial access to medication, all are encompassing in terms of how we're able to deal with the challenges that we face. Some people have more access to resources and therefore they fare better in terms of how they're able to cope, while others unfortunately don't have the same challenges or access. Our social support system is imperative in terms of how we handle and cope with the challenges that we face. The social system encompassing spending time with family or having friends that you can actually go to talk, to unwind, to express, or to even vent. So our social support system is important in terms of getting us through times where we would normally feel alone. Now, the social support system does not necessarily focus on one person, for example, that person being your spouse. Having your spouse as your only support system, you run the risk of not only depleting yourself of that social support system, but as the person themselves. Sometimes people get a little bit overloaded, they're unable to give you the support that you need. Therefore, it's better to have an abundance of social support systems as a whole when you need them. Our biological, psychological, and social predisposing factors also have a lot to do with how we handle pain, anxiety, depression, and all their mental health issues. So biologically, some people are more predisposed to depression or anxiety depending on their biological or chemical factors. Psychologically, people who have diagnoses previously of depression or anxiety or OCD, etc., may have a more difficult time dealing with additional life challenges. As well as, so we covered biological factors, psychological factors, and social predisposing factors. Again, people who are isolated, people who are alone, may have a harder time dealing with new challenges in addition to compounding pain or anxiety they may previously already be experiencing. We're rarely going to find ourselves free from anxiety, free from problems, free from stress. Despite being able to achieve some degree of normality, of equilibrium, of mental wellness, we are all going to experience some form of intrusive thoughts. And what I mean by intrusive thoughts, to define that, intrusive thoughts can be anything that is negative or positive. It's a thought that disrupts your daily functioning, whether you're working, whether you're sleeping, just your presence in the moment. Any thought that distracts you from what you're doing is referred to as an intrusive thought. These intrusive thoughts can be accompanying physical sensations as well. Physical palpitations, dizziness, nausea, anything that has a physical sensation that is uncomfortable. Palpitations are consistent with anxiety and panic attacks as well. Now, these are at times obviously unavoidable. Whether you're happy, whether you're excited, whether you're distressed, there are going to be physical sensations that you will experience. The severity, the frequency, and the duration of the intrusive thoughts depends on each particular situation and each individual person. So the thoughts that you have and the physical sensations are accompanying and they're in conjunction with one another. So if you're anxious about an event, about a divorce, about a work issue, about financial issues, all those thoughts will be accompanied with physical sensations: nausea, palpitation, sweating, vomiting, tingling, lightheadedness. There are about 1,000 different sensations that one would experience accompanying those thoughts. Now, in addition to various different modalities such as solution-focused therapy, cognitive behavioral therapy, psychodynamic therapy, just to name a few, mindfulness can either be used in conjunction with those other modalities or alone by itself. Mindfulness is not necessarily used for every issue or every person. It usually can be used in conjunction with another therapy and or with medications as prescribed by your physician. So one of the most important facets or the basic principle of mindfulness is manifested upon a precise adherence to the present moment by training the mind to revert back to the moment regardless of what thoughts and emotions are experienced. So what that all means is that whenever you're doing something, again, whether you're at work, whether you're cooking, you're washing dishes, you're playing with your kids, you're watching TV, whatever that you're doing, that's the moment in which you are interrupted by an intrusive thought that's causing you distress of some kind. So you first experience the thought, you now experience the physical sensations. For example, you're anxious about an event, you start to experience palpitations. So that's the accompanying physical sensations to the negative thought that you're experiencing in the moment. Now, the premise of mindfulness does not suggest that you disregard that thought or you disregard the experience or disregard the accompanying physical sensations. The most basic premise of this modality is to allow the intrusive thoughts to manifest and for one to actually experience them in the moment, in real time, as they occur. So if you're sitting watching TV and all of a sudden you're starting to experience palpitations or you're lightheaded, the worst thing to do is to force yourself to go back to what you're doing. The point of mindfulness is to experience what is going on. Allow yourself to have that experience manifest itself, regardless of how negative or traumatic it may be. Because if you're suppressing a negative emotion, if you're suppressing trauma, you run the risk of not only intensifying the negative thought, but also re-traumatizing yourself. Any kind of avoidance or suppression results in re-traumatization and those negative feelings coming back. Now, analogous to panic attacks, if anyone has experienced them, the more you try to avoid the panic attack or suppress, the more it happens, the more you're unable to avoid it. The point is that you experience it, you allow your mind, your body, your thoughts, your physical sensations, your emotions to be completely immersed in that experience. Again, we're not arguing that the experience is negative or that it's uncomfortable, but the point is that if you don't experience it, similar to if you don't talk about your problems, that they are not addressed, they will return of the repressed, as a Freudian expression. So the more you suppress, the more you conceal, the more you avoid, the more you run the risk of intensifying those emotions and not dealing with them. Not dealing with them ultimately results in them not being resolved. So the point is that now how long do you allow yourself for that experience to manifest? I actually tell my patients to time themselves. Actually take a timer on your phone, 5 minutes, 10 minutes maybe. I would start with 10 minutes as beginners to allow that experience to manifest. So essentially, you're going to allow yourself an allotted time of 10, 5 minutes, maybe even 15 minutes, depending on how often it's happening, to worry about what's going on, to allow the sensations to occur. Once that 15 minutes or 10 or 5 minutes duration is over, you now retrain yourself back into the present moment, whether you're washing dishes, whether you're watching a movie. That is not to say that the experience will not again reemerge. It will. The question is, the more you practice being able to retrain your mind back to the present moment, the duration, the frequency, and the severity of the intrusive thoughts will decrease. Again, it won't happen overnight. It won't happen with the snap of your fingers. It can only happen through practice, gradually over time. So again, bringing your attention back to the present moment. Now, facets of mindfulness. Mindfulness is a type of meditation in which emphasis is placed on your feelings and your thoughts as they occur in the moment without judgment, without interpretation, without any form of analysis. So in contrast to other modalities such as cognitive behavioral therapy, which is very much focused on objectivity and evidence-based practice, so providing evidence for each negative or intrusive thoughts, mindfulness is not focused on interpretation necessarily, rather than having the experience. It's subjective, whereas we're not trying to assess it in a logical manner, but to allow each individual person to have that each individual unique experience. One person's trauma, one person's emotional reaction, one person's anxiety or depression is different than someone else's. That's why mindfulness is subjective and not to be used as a means of judgment and interpretation. So we're just going to allow the experience to manifest without assessing it. So observing the raw emotions, the sensations that correspond to your thoughts. So for example, when you start to have an intrusive thought, you might be feeling a sharp tingling feeling in your fingers, a burning feeling, your stomach feels upset, you might feel lightheaded, you might have palpitations of shortness of breath. These are all the sensations that occur in conjunction. Again, very similar to a panic attack, depending on what your experience may be. So it's important to be cognizant of your thoughts and emotions as they occur. Again, to not discount, to not judge, to not interpret, essentially to allow yourself to have that experience within the allotted time. So this does not suggest that you're going to sit there for 24 hours and have these thoughts and these feelings. The point is, as you get more comfortable, as you practice, you bring your attention back to the present moment. So it's important to be aware as well of situations that precede the thoughts and the raw sensations. So for example, what was happening prior to you having the intrusive thoughts? Did you have a headache? Were you upset about something going on? Did you have an argument with somebody? Were you in a lot of physical pain that preceded the thought? Sometimes even a positive event, a positive emotion, such as, getting a new job, having an event that's successful, even the positive anxiety can create an intrusive thought. It does not necessarily have to be negative. So becoming tolerant, becoming accepting, becoming receptive is a significant part of mindfulness. Again, we're not looking at objectivity of analysis or necessarily logic, but the ability to be tolerant of what is going on with your thoughts, with your feelings, and with your body. The ability for you to cope with pain, with anxiety and depression is enhanced when you're able to experience the negative emotion, process it over time, and then relinquish not only the thoughts, the emotions, but also the physical sensations that accompany them. So trying to avoid condemning or judging or avoiding is fundamental with respect to mindfulness. Again, when you're having the intrusive thoughts, refrain from judging the situation. All you're doing is experiencing something. Imagine you're on a beach and you're experiencing the sensation of the waves, the water, how the sand feels, which I'll be talking about imagery in upcoming sessions. But just to give you an idea of, you are focusing on the experience in a subjective manner, not in an objective analysis kind of manner. So becoming conscious and familiar of your own habits and patterns of behavior as they occur in the moment. This can cultivate an attitude of being non-judgmental, being receptive, being open, and being tolerant of the experiences as they occur in real time. That was a general overview of what mindfulness is. Please don't forget to press like and subscribe, and I'll see you back next time for the second segment.